Hi guys and welcome to another video. In this video we're going to learn how to recognize and treat head injuries. So let's start. Okay, let's start with the different types of head injuries. Generally there are two types. We have outer head injuries and we have inner head injuries. When we're talking about outer head injuries, we're talking about mostly about trauma injuries. So for example, the patient can bleed from his head, he can fracture his skull, and he can show some exposed tissue if it's a really strong outer head injury. And when we're talking about inner head injuries, we're talking about more internal things. So for example, a concussion or an internal bleeding. Okay, so let's start with how to recognize outer head injuries. The way we can recognize them is first just by recognizing a normal injury. If a person is bleeding from his head, or if he has some exposed tissue, then we will know it's an outer head injury, right? Well, there are another thing that we need to consider. If a patient has a skull fracture, then in some situations we will not be able to see that he has an outer head injury. Now, these skull fractures are very important to recognize because that means that he needs immediate help. So he might not show any signs of an injury, but he might have a really severe head injury. So there are some ways to recognize that it is a skull fracture. Actually, to be more precise, there are three ways that we need to consider. The first one is recognizing something that is called raccoon eyes. Raccoon eyes is when our patient will have like black marks around his eyes that will show us that he probably had a head injury. On top of that, there's a thing that is called battle signs, which is basically the same but behind the ears right here. We will see purple signs or blackish signs, which will also make us worry that he has a skull fracture. And lastly is if he has a clear substance, I should say fluid, if he has a clear fluid that is coming out from his nose or from his ears. That fluid is probably the CSF, which is the fluid that our brain kind of floats inside of our head. And after having a really severe skull fracture, then that fluid can come out of the nose or from the ears. It is generally transparent or maybe a tiny bit yellowish, but that is the color of that fluid, and if we see it coming from the nose or from the ears, then our patient definitely is having a very severe skull fracture. Okay, now for the treatment. Now again, the reason why we need to know how to recognize these things is because in some situations we will not be able to know that our patient is having a head injury unless we can spot these signs of raccoon eyes, battle signs, or CSF fluid coming from the ears and nose. So if we recognized one of these signs, then we should consider that our patient is having a very severe head injury, a very severe skull fracture. And if that is the situation, then the treatment would simply be to call for help immediately. Even if our patient is completely fine and he's walking and everything is fine, if we see that he's having CSF fluid going out from his nose, we should make sure that he will get to the hospital ASAP. Now, on top of that, if we see any different kind of head injuries like bleeding or exposed tissue, then we should just bandage it to make sure that there is not going to be any infection. Now, as we learned in the bandaging video, when you're bandaging the head, you shouldn't really put too much pressure on the head, especially if there's any exposed tissue. You don't want to try and push it back in to inside the head. All you want to do is you want to very loosely bandage it so it will stay in place and you don't want to put any pressure on it. Your goal is to make sure that it will not get infected. Okay, sweet. Now let's talk about inner head injuries. Now here too we have two different types. We have general impact injuries and we have focused impact injuries. General impact injuries are usually just concussions, while focused impact injuries are internal bleeding. Let's start with concussions. And to start with concussions, we should probably understand a bit the autonomy of our head. Our brain, it always floats in some sort of fluid that is called the CSF. Now, the cool thing about our brain floating in this kind of fluid is that it always stays in place. So basically, even if I will move my head really strongly to the sides, my brain will not really touch the skull. It will not hit the side of the skull unless I get hit in the head really, really strongly. And then my brain can touch the side of the skulls because of the force of the impact. When our brain touches the side of the skull, that is also called a concussion, which is the general impact injury. Okay, now for the signs. The signs of a concussion include headache, dizziness, confusion, nausea or vomiting. Our patient can also temporarily lose his consciousness as well as temporarily lose his memory. Now, the thing about concussions are that in most cases, they are not life-threatening. However, if we see any signs of a concussion in our patient, we should still make sure that he will go to the hospital or see a doctor very quickly after. Okay? And there's a good reason for this. The reason why is because if we see any signs of a concussion, we should really be worried that our patient will also have the other kind of internal injury, which is internal bleeding. Internal bleeding in the head is very dangerous because it creates more and more pressure in the head of our patient, and the bleeding can't really stop by itself. So the thing about internal head bleeding is that, well, it will never stop. The pressure will just increase and it will become life-threatening very quickly. And so if there are any signs of general head impact, we should be also worried that he might develop also signs of a focused head impact. Okay, now for the signs. The signs of an internal bleeding inside of the skull are headaches. They can also cause nausea and vomiting. They can cause a partial loss of consciousness as well as a complete loss of consciousness. Now, as you can see, the signs of an internal head bleeding and the signs of a concussion are fairly similar. And I want to say this again. If we suspect that our patient has a severe head injury or we see any different kinds of symptoms, then we should always make sure that we call for help and that our patient gets to the hospital. Okay, and that brings me to the treatment. Now, the first thing you'd want to do is, as mentioned, if you recognize any different signs or symptoms after a head injury, you will make sure that you will call for help. Second is you want to monitor after the consciousness of our patient. We will usually do this while bandaging him and while making sure we take care of all the other injuries. Because if I'm being honest, usually if our patient has a head injury, then in some situations he will also have other injuries, or we will need to bandage him and things like that. But lastly, if our patient did lose his consciousness, then we want to make sure that we keep his airway open the entire treatment until the ambulance arrives. Okay, and that is it for this video. This is how we make sure that we recognize and treat a head injury. I hope you guys learned new things and that you enjoyed this video, and I'll see you in the next one. Bye guys!